All right, so we're back again for another edition of Doctor's File with Dr. Mulenga, who seems to be upbeat after bashing the men the past 2 weeks, or this is the past two editions.
Now we deal with women. Let's take something that is really troubling the ladies: menstrual problems.
Menstrual problems.
Yeah.
I thought the only problem with menstruation is that they come every month. Is there any other problem, really?
There are problems like heavy periods, okay? There are problems like prolonged periods. There are problems like absence of periods, painful periods.
So you mentioned a number of menstrual problems there, but which do you face the most?
It's in our understanding we call it amenorrhea, right? Which is heavy, prolonged periods.
Okay.
Okay. Then the next one we have problems with is bleeding between periods, which we call in medical. Don't bite your tongue. Metrorrhagia. Metrorrhagia. Okay. So that's bleeding between periods. Sometimes they call it spotting. And then the other major problem we have is painful periods. In science, we call it dysmenorrhea or agomenorrhea. Agony. Okay. Agomenorrhea. Yeah, painful periods. And then absence of periods, amenorrhea. The heavy prolonged periods of more than 7 days, you have to look, for example, if there is something like a tumor growing in the uterus. Because you see, when you are having menstruation, towards the end of the menstruation, which is 4 or 5 days average, right? The uterus contracts, it becomes small and squeezes itself, so thereby stopping the bleeding. So if there is something growing inside, for example, a fibroid of the uterus, then it won't contract, and that can lead to prolonged bleeding. That's one. The other one, so that's fibroids, right? The other one that can lead to heavy prolonged menstruation is hormonal imbalance. Hormones, estrogens, progesterones, follicle-stimulating hormone, luteinizing hormones. When they are imbalanced, these hormones are produced, the progesterone and estrogens are produced in the ovary, the egg. When there is imbalance, maybe due to stress or some other factors, then you can get problems with menstruation.
But do these causes overlap with the other menstrual problems you've talked about?
Like painful periods, like bleeding between periods, yeah. Metrorrhagia.
Pain and having no periods, which we'll come to in a moment. Maybe I'll leave that one for last.
Sometimes they are independent. Sometimes they can be. You can have, for example, you can have what we call metrorrhagia, meaning heavy, prolonged, and between periods. So that's a combination of two problems, right? Okay. And sometimes you can have heavy, prolonged periods with pain. The other one, intermenstrual bleeding, intramenstrual, between periods, could be, for example, if you have got small growths on the cervix, an inflamed cervix. Small growths can be like polyp, what we call polyps, small growths. You can have inflammation of the cervix, cervicitis. You can have cancer of the cervix. So these are bleedings which are chaotic between periods. You see on and off, on and off. So cancer of the cervix, polyp of the cervix, cervicitis, chronic inflammation of the cervix. That can lead to that.
Yeah, for the painful periods, this is something, personally, I know that women complain about.
A lot.
And maybe we can even start with the causes, but I am really curious about the solution to this one, because it's always a constant question.
I think
how do we stop painful periods?
I think the problem here is not even the cause, because we don't really know the cause of painful periods, right?
Oh, really?
Yeah, no, the cause is not yet established. We know what happens with the uterus, what chemical is released, which causes pain, but we don't know why. Okay. So that's an open question in gynecology. But what is most important is what to do when somebody is having painful periods, dysmenorrhea. The The approach is to, you can't treat dysmenorrhea or painful periods, right? You can, no, not treat, you can't cure, okay? But you can treat. That means you can control it. The approach is, if you are having painful periods and you can continue doing your daily household activities, just leave it. It's fine. You don't need any drugs. If you are having painful periods and you are unable to do daily household activities, then you need treatment. And the treatment we advise here, we use drugs that we call antiprostaglandins. Prostaglandins are the chemicals that produce pain in the uterus during menstruation. Mm-hmm. So when we give drugs that are anti-prostaglandin, like aspirin, Indocid, Brufen, diclofenac, mefenamic acid, these can assist a woman to go through that period. Painful periods can be before the periods, during the periods, and after the period.
But really, how effective are these drugs? Because the complaint is always, I have tried every medicine.
No, I don't believe the ladies who say I've tried most
But medicines. I'm sure you've heard that a lot.
Yes, but I always challenge the ladies. Yeah. If you have tried Indocid, diclofenac, Brufen, Panadol doesn't work, by the way, and you have tried aspirin, most haven't tried aspirin. Huh? They think it's a cheap drug and it doesn't work. It works, miracle. But then the miracle drug here is mefenamic acid. So when they tell me they have tried all the medicines, I'll find out something they haven't tried. So one of the medicines usually works. It's a matter of looking for it.
So this is the part where now I backtrack you again to the excessive bleeding. You said prolonged bleeding during things.
Menorrhagia.
Do we have solutions for that as well?
As I said, it can be fibroids or hormones. If it's fibroids, depending on the size, you need to remove them or remove the whole uterus. Just
the
throw
whole
it.
Uterus?
Yes, just throw it out. Look, if the fibroid is so bad that it has covered the whole uterus, you don't need the uterus. Still, it's not going to give you.
What happens to somebody?
It's going to not give you a baby anyway.
To have babies?
Whether we remove it or we don't, you ain't going to get a baby, because if the fibroid has covered the whole uterus, even if you got pregnant, it will come out. So why keep it? Get it out and solve the bleeding problem. Bleeding can kill you. So get it out.
Now, my favorite, I was keeping this one for last because I know this one, I don't even need your help, doctor.
Okay.
Amenorrhea, no periods.
Absence of periods.
Somebody's pregnant. Let's move on. Next topic.
No, not really. But you are right. You are right on the way. In another way, because
if she calls you and says, "I've missed my period," she's pregnant.
What we do is that every woman who walks into our consulting rooms is pregnant, including the vice president. You are pregnant until proven negative. Okay. Yes. So every woman is pregnant. If she's complaining of absence of periods, the first thing that comes to mind is pregnancy. If we rule it out, then we go to the other things that can make you have no periods. One, your age, about 40 to 52. That is menopause. Okay? That's pregnancy, menopause. Then we get, like the story I told you, there are other times when we were dealing with, I think we were dealing with premature ejaculation.
Yes.
Or we are dealing with, we are dealing with erectile dysfunction. Stress, like when Iraq was being bombed, right? When Iraq was being bombed, what happened was that the women in Baghdad stopped menstruating. So, stress. You treat the cause. If you are being bombed, you stop being bombed. And if you are pregnant, deliver.
Yeah.
Then you get your periods afterwards. If you are menopause, accept that the time is gone. You are done. You finished. If you are stressed because you borrowed money, you can't return it. Return the money and the periods will come back.
There is this notion that some people continue having the menstrual periods after they've gotten pregnant. I just want you to talk about it.
Complete nonsense.
Okay.
Yeah. Just one word, nonsense.
Really?
Because if you are pregnant, there's a baby developing in the uterus. And how do people think that you can still menstruate? Because when you are menstruating, it's the endometrium, the inside layer of the uterus, which comes out, which sheds. So if the baby is growing there, how can it shed the inside? That means it's an abortion, isn't it? So no, it can't happen that you can be pregnant and have menstruation, but you can be pregnant and bleed. They are two different things.
Okay.
And any bleeding in pregnancy needs assessment. It means it's in early pregnancy, it means it's threatened abortion. The pregnancy is unstable. If it's late in pregnancy, it means it's antepartum hemorrhage. What they say, intra-pregnancy bleeding. That needs assessment because the placenta could be involved, it's not lying properly, it's detaching and all. So any bleeding in pregnancy is not menstruation. It's bleeding and it should be attended to.
Just before we just sign off, just a word on how people can follow up if they have any further questions.
Yeah, it's interesting. The doctor's file is now on YouTube.
Okay.
We have provided a link in the doctor's file where people can link and subscribe to this channel so that they can have more information, visual information.
Fantastic.
While we are talking. So yes, and also while on YouTube you find also a link there to the doctor's file on Facebook.
Oh, fantastic. So basically it goes back and forth and you can get more information in those forums.
Really.
Thank you very much. Looking forward to another edition of Doctor's File. We do
Thank you so
appreciate
much.
it.